Hello, my name is Scott Croston, and today I will be talking about arterial catheter insertion. There's a few things you need to know before you start inserting catheters. First thing is prerequisite nursing knowledge. You need to have knowledge of the anatomy and physiology, knowledge of sterile technique, understanding of hemodynamic monitoring, and the conditions that warrant the use of arterial pressure monitoring, such as bleeding, actual or potential, continuous blood pressure monitoring for hypo or hypertension, or in the instance that you're using vasoactive medications, it'll give you that dynamic reading to allow you to continuously titrate that medication regimen. So the next thing you need to do is to educate the family on the procedure, what you're doing, why you're doing it, and how you're going to go about doing it. You need to explain the procedure and the purpose in order to decrease the anxiety from the family and the patient. You explain the procedure to the patient, tell them that it is going to be uncomfortable, you don't want to lie to them. But explain to them that you will be using local anesthetic in order to make the procedure more comfortable or bearable, and help them to relax and relieve some of that anxiety, because sometimes these aren't the easiest lines to place, especially if you have somebody hemodynamically unstable with a low blood pressure that's you can't feel their pulse, or the patient's confused or moving around, and so you need as much help from the patient as you can get. Next, you will need to do a patient assessment and preparation. So you'll need to complete a complete history, and any extremity that's had any type of vascular surgery, you need to avoid that extremity because of potential complications. Patients with diabetes or hypertension are at greater risk for arterial or venous insufficiency. You need to assess the patient's history of coagulopathies or anticoagulation therapy. This will decrease the patient's chances of hematoma or hemorrhage. You also need to assess the patient's allergies for lidocaine or topical anesthetics. You need to assess the patient's presence of collateral flow. You can use the modified Allen's test for that. And if available, you can use the Doppler ultrasound. It'll help you see collateral flow, and it will help you be more successful in placing those lines. So in patient preparation, we're going to verify the patient with two identifiers, perform a procedure verification and timeout. We're going to ensure that the patient and family understands what's going on, again, when we educated them the first time, to make sure that it sunk in. And obtain informed consent. Place the patient in a supine position with the head of the bed in a comfortable position. If the provider has chosen a site, you want to elevate that site and hyperextend the extremity and palpate the artery. If it's a femoral site, you want to lay the patient supine in a comfortable position, because they're going to be laying in that position for a while, and if you want to get a good reading, you want to keep them comfortable and laying still as possible. So you will need a 2-inch 20 gauge catheter, in which this is what you place into the patient's artery. You always go bevel up, and you want to go about 30 to 60 degrees and insert it till you get your flash. Go in another quarter to a half inch, flatten out, and advance it all the way to the hub, and then you'll pull the metal out, and you'll have your plastic catheter tip that is left inside the patient. If you're going femoral route, you want to go 60 to 90 degrees just because it's a deeper site. You're going to need a pressure module and cable, pressure transducer system, non-sterile gloves, sterile gloves, 2% chlorhexidine, transparent occlusive dressing, 1% lidocaine without epinephrine, sterile saline, 3 milliliter syringe with a 25 gauge needle, and ultrasound machine with sterile probe cover. So first of all, you obtain the ultrasound equipment, ensure the single pressure bag is prepared, perform hand hygiene, perform physical assessment, place a waterproof pad under the selected site, determine the anatomy of the artery, perform a modified Allen's test, prepare the site with antiseptic chlorhexidine, remove the gloves and perform hand hygiene again, apply sterile gloves, drape around the site. You want to apply your anesthetic to the puncture site with your 1% lidocaine, and then you will intradermally inject your lidocaine in a circle around the area that you will place your catheter. And like I said, you'll go 30 to 60 degrees, get your flash, flatten it out, and advance it all the way to the hub and pull out your needle. And then you will level your catheter to the skin and continue to advance your hub. Like I said, once positioning is confirmed, remove your stylet and connect the catheter to the single pressure transducer system. And and then you will observe your arterial wave, secure your arterial catheter in place, apply your occlusive, and then you will have to zero out your monitor to your line to your monitor, and you'll have with your pressure bag and your monitor, you'll pump it up, turn your stopcock, and hit 0 and flush your line and zero it out to your barometric pressure, and you will put your transducer at your plebostatic axis. Once all that looks good, you can remove your gloves and discard your supplies in the appropriate receptacles and complete hand hygiene, and you're finished. Thank you.